in this video, we are going to talk about the EDI, the electronic data interchange in the healthcare industry. Let's start with the basic definition of what EDI is. So EDI is the electronic transmission of information between two systems or two organizations. The EDI process allows the data exchange of business documents or information from one company to another, and thus it enables an automated and paperless communication which is secure, efficient, and reliable. And EDI does exist across multiple industries. It includes the healthcare, the financial services, the retail, automotive, and any other industries. Now, EDI in the context of healthcare, it provides a secure electronic data exchange between the healthcare providers, the health insurance companies, between the sponsors, which could be the groups, the employers, and the individuals, the third parties, the government, and the patients. And it allows the organizations to exchange the data very securely and efficiently. And most of the healthcare organizations, they use different applications and systems in their own ecosystem, and that's where there is a need to standardize the format in order for them to talk in a common language. Down below, you see the different EDI transaction sets within the healthcare industry. We are going to talk about these in detail in the coming slides. But at this point, just so know that these are all the numbers that are indicated on any EDI transactions. Like we have an 837 that is used to identify a healthcare claim. We have an 835 that is used to identify a payment that the insurance sends back to the provider. So we talk about the X12 EDI. So let's understand what X12 is. So it's a group or it's a committee chartered by the American National Standards of Institute, which is called as ANSI, and they have been developing the standards for over years now. And the X12 has two committees. One is called an ASC and other is called an RSC. And ASC is the committee that is responsible for maintaining and interpreting the X12 standards, and these are the standards that we currently use in the healthcare industry. And for each of the industry, there are different healthcare transaction sets that were defined, and we are going to talk specifically about the healthcare EDI standards in the current video. All right, now looking at the standards, as you can see here, the ANSI X12 is the predominant standard that is used in the North America for the electronic data exchange. And in addition to the X12, if you can see, we have EDIFACT, which is one of the standard used outside of the North America. We have Tradacom, that is pretty much used in the UK retail industry. We have Audit, which is used in the European industry. And we have other standards like the NCPDP, which is used for maintaining the pharmacy. And we have HL7, which is another common standard being used in the healthcare for exchange of clinical data. Now let's look at why there was a need for an EDI standard. So traditionally, going back over 2 years in the past, we used to have something called a point-to-point, wherein each of the system used to interact against the other system in their own interchange or interface that was developed between those two systems only. On the left, if you see, there are multiple points within each of the system. With EDI, we are going to come up with a common standard language which each of the system would understand and exchange data with each other. That's where EDI helps in standardizing the format so all the systems could understand a common language. Now, EDI in the context of healthcare, as I mentioned in my previous slides, we have different EDI transaction sets that were created for each of the purpose. Now, if we understand this workflow, on the left, we have the sponsors here. So these sponsors are the employers or the government or the individuals. So whoever are buying the insurance plans would become the sponsors, and then the payer is the insurance company from whom we buy the insurance, and then we have the providers who actually provide the services. It could be a physician, a clinic, a hospital, a nursing home care, and then we have the pharmacies. So the 834 transaction, which we see here, is called as the enrollment and maintenance. This is the transaction set that is used to enroll the membership or the benefits. Now, whenever say an employer buys an insurance plan for his employees from a payer A, that employer needs to send the file over to the payer. And then we have the 820, the premium payments, which is nothing but which tracks the premiums that are paid on a monthly basis or a bi-weekly basis by the sponsors to the insurance companies. And then we have the 270 271, which is used for the eligibility request and response. This is where the providers would reach out to the payers to know whether the member or the patient eligibility is active or the benefits are active, and they get the response accordingly. The next one is used to track the status of the claim. So these two transactions, 270, 271, 276, and 277, are basically the real time. And then we have the 278, the authorization request and response. This is used to track the authorizations. And then we have the 837 claims, which is used to send the bill by the provider to the insurance companies. It has multiple types within that: the professional, institutional, and dental, which we'll talk about shortly. Then we have the 835. This is the payment receipt or the payment advice sent by the payers back to the providers. And the 837 and 835 again are covered separately for pharmacy here, because of the way the claims are received from pharmacy and the remittances are sent back. And across all of these, we do see we have the clearing houses or the third parties. So these third parties are used by the payers, the providers, and other organizations to transmit the data or transmit the claims, the payments, or any other EDI transactions that you see here. And we're going to talk about the clearinghouse shortly and why they are being used. So before we get into more details, let's understand some of the terminologies. And these terminologies are important for you to understand the workflows in a way. All right. So a subscriber or member, the primary policy holder that's on the insurance plan is called as a subscriber, and any dependents that who are under the subscribers policy are called as the members. And in a way, a subscriber is also a member. So if an individual ABC has three dependents under his plan, so that plan would basically has four members, and one of them, the primary individual, is called as a subscriber. Providers, anyone who is providing the healthcare services, the physicians or the hospitals or the facilities, they are called as the providers. Payers, all the insurance companies would fall under the payers bucket here, and they do provide the health plans to the employer groups or even the individual employers or groups. These are the companies or the organization who employs people, and then they buy the group insurance from the health insurance companies, and they normally have the contracts with the payers for providing the group insurance. The government also plays a key role in the US healthcare industry. They do run the programs, the government programs like the Medicare and Medicaid, and they are the one who formulate these plans. and they also dictate the regulations and mandates. Like HIPAA is one of the regulations in the US industry. So clearing houses, so these are the third parties or the mediators who help with the administrative activities on behalf of the payers and the providers. So they pretty much receive the claims from the providers, they scrub them, do a basic checking, and they send it over to the payers, and then they receive the remittances back from the payers and they send it over to the providers. And one of the known clearing house is MDON. So what is a claim? It's nothing but a document or a form that goes from the provider to the insurance company in order to get paid for the services they provide to their members. Earlier, it used to be a paper form, but now most of the organizations are on the electronic version. And the EDI transaction that we looked at in the earlier slide, the 837, this is the electronic version of a claim. A payment or a remittance is an 835 that comes from the insurance company to the providers. So there is a typo here, it should have been an 835 in the definition. Sorry about that. And then the patient EOBs or statements. So EOBs are the explanation of benefits. It is a document or a statement that's sent over by the insurance company to the members. It explains how the insurance have processed their claims that and what services the member has received as part of his visit. Let's talk about the claims workflow in brief. 837 and 835 are the key transactions, and also 834 and others of course, but these are the transactions that happens in volume. So let's understand the workflow here. Now at the top here, so it's pretty much a clinical workflow wherein a member calls up the provider to get an appointment. Then on the day of the appointment, he visits the hospital. He goes to the front desk. The front desk will check them in. The physician or the doctor would examine the patient, and as part of that encounter or a visit, there may be some tests that he might order. It could be like a lab or a radiology test. The test gets completed and depends on the results that are obtained back from this. The doctor would determine the next course of action, and accordingly, considering this is say an outpatient visit or a clinic visit, the patient would go back. Now what happens behind the scenes, all of these services provided by the physician or the doctor will have to go into the billing system, and those transactions go in the form of charges for whatever tests that were done or whatever services the physician has provided. So all of these would get eventually into the hospital's billing system. They all these charges then gets consolidated for that specific visit into something called as a claim, and then the hospital's billing system would generate an electronic version of that bill for that specific patient, and they convert that into something called an EDI 837 format that you see here. So 837 is used for a claim, and that electronic version would then sent over to the payers. Now when this transaction goes up to the payers, most of the organization do also use a third party called a clearinghouse who kind of does a job wherein they would pick the documents or the claims, and depending on who the payer is, they would then send that claims over to their specific payers. And there could also be a mechanism wherein the provider has a direct relationship or direct interface set up with the payers, then they upload the claims directly to the payers system. Now, considering the claims are going through the clearinghouse, they go back to the insurance companies, and the insurance companies would then have a process place on their end to do the claims adjudication. So this process is nothing but it looks at the claim, it examines the claim and determines if it's valid. Valid in the sense the membership is active, the providers are accurate, the services that were done are as per the contract. So once all the determination is done and if everything goes fine, the payer approves the claim, and if not, they would reject the claim, and if there are questions they would pend it and they would send that in the form of a review back to the provider companies, and then they have their own team who looks at the claims, who reviews them, and they send those responses back, or they submit the claims again, which goes over through this process again. And then once the claims are through successfully, they are approved, the payer would generate something called a remittance or a payment advice. So this remittance is nothing but a paycheck or a payment receipt that has to be sent back to the providers. So they again use the clearing houses to send these 835 EDI format back to the providers. The providers then load these into their system, they reconcile those, and they get the payments. The payments could be in the form of checks, it could be in the form of the electronic transactions. And then at the end, the insurance company would generate a explanation of benefit that would go back to the patient or the member, explaining what the services were provided by the insurance company and how much they have charged for those. Okay, let's understand more about what's the role of a clearinghouse. We have seen in our previous slide that the organizations use a clearinghouse as an intermediary step before transmitting any claims or receiving the payments. So a clearinghouse is a third party which basically acts as an intermediary between the providers and the insurance companies. They collect the claims from the providers, perform the scrubbing, and routes them to the insurance companies. And in return, they receive the payments or the advices from the insurance companies, and again they do basic scrubbing there, and then they send those files back to the providers. So what do they gain out of this? They do charge a nominal standard fee for processing the claims, payments, or any other transactions, depending on their contracts that they are set up with. Even though we are seeing just 837 and 835 transactions here, a clearinghouse would also takes care of, in some cases, these 270, 271, the 276, 277, and the 278 transactions as well. Let's look at the EDI transaction sets or the formats that we talked about. Now, this table tells you all the EDI transaction sets that are being used in the healthcare industry and what version they are currently. So the 837 that you see here, these are the transactions used for claims. Now within 837 we have a professional claim which is identified by P, then the institutional claim, which are the hospital claims identified by I, and then we have the dental claims identified as a D. So the transaction set is referred to as 837 in the EDI language, and then each of these comes up with a version. So the version that you see here, 005010, is the ANSI X12 version that's currently in use, and then each of these version would have a subversion, you can say, like 005010 has got a X222, which is used to identify your 837 professional claim. And similarly, we have the 835, we have the 834, which is used to enroll the membership and the benefits. 820 is used for the premium payments. 270, 271 is for the benefits eligibility, inquiry and response. And 276, 277 is to understand the claim status. We have the 278, which is for the pre-authorization, to review the request and responses. And the last two are more the acknowledgements or the uh, responses back when we send the claims back to the insurance companies. Under 837, what are the different types of claims? We have three types of claims. The professional claims, which covers the office visits, the outpatient clinics, and any professional services. And the corresponding paper format for 837P is called as an HICFA 1500. If you go online to the CMS website, you would be able to find these formats for the 837P as well as the 837I. So 837I covers the institutional claims. So these are the claims wherein the patient gets admitted to the hospitals. So pretty much all the hospital claims go as institutional. And then we have the dental claims. 837D is covered for that. So these are some of the links from the CMS website wherein you go and find those forms, how the paper forms looks like. It would also help you to understand what are the different data elements that go on a claim. So the 835, the electronic remittance advice or the payment advice. So it contains the information about the subscriber, the payer, the amounts, and the mode of the payment that needs to be done. So when the insurance company sends the payments back to the providers, as I mentioned, they could be in the form of a check or they could be in the form of a electronic transfer. And ERAs can be sent directly or through the 835s as well. So each of the 835 transaction, it reflects one payment. Like if there are two modes of payment, it would come as two different 835 transaction sets. And you could also always have one file with multiple 835 transaction sets. 834. So what's an 834? EDI 834 transaction is used for the membership and the benefits, enrollment and maintenance. So it has information about the subscribers, about the plans, about the benefits and the products or the services that the members would buy from an insurance company. And this transaction is used by the employers, by the brokers, by the exchanges, by the government agencies in order to enroll the members into a healthcare plan. And it primarily used for enrolling a new membership which happens annually, or if you need to send updates over to the members, the 834 transaction can be used, or reinstating any membership or termination of a membership. So these four primary categories is what the 835 transaction would send the data as. So what is an exchange? And exchange is pretty much tied to the 834. So normally in a normal scenario, you would have your insurance being purchased by your employers or the groups. That's where they would send your 834 enrollment file back to the insurance company. Exchange is a marketplace, we can say, which is more of a shopping area, a comparison shopping area for the health insurance. The private health insurance companies would list their plans on the exchange. The people would go there. It could be the individuals or it could be even the small employers who go there, who does a comparison of the benefits and plans, and they purchase the plans from the exchange directly. The public health insurance exchanges are used to buy the individual and family health insurance plans, and these are compliant with the ACA, the Affordable Care Act. The individual or the family or the individual here refers to the health insurance that people buy on their own, which is in contrast to the insurance that they obtain through their employers or through the government. And the largest health insurance exchange, if you go to the healthcare.gov on the internet, you would find more details over there. And this is the exchange that's run by the federal government, and it has a lot of health insurance shoppers that go there to buy the insurance, and this is across 36 states as of 2021. The remaining states run their own exchanges. We have different platforms like the Nevada Health Link, New York State of Health, and Connect for Health Colorado. If you go and Google these, you would see more details around these exchanges and what type of plans they do provide. The 820 EDI transaction is used for the premium payments. So these are the amounts that are paid by the members or the employers to the insurance companies or to the exchanges. Now a subscriber could buy plan from the insurance company through their sponsors. So the sponsors could be their employers or the groups, or it could be the government, or a subscriber can go to the marketplace and they can buy the insurance directly from there, which means they have to pay the premiums to this exchange from where they bought the plan. Now the sponsors in this first flow would then pay these premiums to the payer companies or the insurance companies, and on the other flow, the if the members are or even the groups are getting the exchanges directly from the marketplace, then the marketplace would then pay the premiums to the insurance companies. So what is a 270 or a 271? This is an eligibility request and response that mostly happens real time between the providers and the payers. 270 EDI transaction is used to request the member's eligibility by the payer to the provider. Think of a scenario wherein a patient walks into the hospital. The front desk would have to check whether the member has an active the member has an active mm, membership or is eligible to receive the services. So that's where the provider would trigger a request to the insurance company in the form of a 270. They will put the details of the member there, and then they would get a response real time from the payer indicating whether the member is eligible to get the benefits or not. Similarly, 276, 277 is again a request and a response EDI transaction. This is used to check the status of the claim. Now, once the providers would send the claims to the payer companies, and at any point of time, if they would like to know where their claims has ended with or what's the current status of the claim, they would send a or trigger a 276 EDI transaction in real time to the payer. The payer would then send back the status of the claim, whether this claim is approved or it's being processed, or if it's rejected, or it would send the status of the claim as is. The 278 EDI transaction is used for the healthcare services review or the authorization. So this transaction set refers to the healthcare services review information. Imagine a scenario wherein a healthcare provider would send this 278 transaction to the insurance company to request an authorization. The request could be in the form of, say, the provider needs to say perform a planned surgery and he's not sure whether that procedure or the service is covered by the insurance company. He would then place a request in the form of a 278 to the insurance company to understand whether that specific procedure is covered by the insurance company. So as part of this request, they would get a response back from the insurance company indicating whether they are authorizing to move ahead with the specific procedure as requested by the provider. So this completes the video. Hope you liked it. If yes, please do hit the subscribe button. Thank you.